Hi everyone, hopefully everyone's doing well and staying safe, healthy and warm. As you can see, my hands are not feeling warm at the moment. Anyways, this week I want to talk about something that is happening overseas and how it relates to what is happening here in Finland. Now, I'm not sure who is watching this video, but I highly recommend that Finnish politicians and decision makers take notes of the public's reactions overseas to the recent assassination of the United Healthcare CEO. Now, it's not just the news itself, but like I said, the reactions of people that reveal the deep-seated frustrations with profit-driven healthcare systems. Because I doubt anyone here wants us here in Finland to go in that direction as well. Now, unfortunately, it does seem like we are headed towards the US healthcare system more instead of what we've had in the past decades. And I'm gonna be bringing up some points in this video, like how and why I think this is happening here. And yeah, just want to point it out to, Finnish decision makers that it is not the way that we should be going, because obviously the system has not worked in the United States. That has been obvious even before this CEO case, I have plenty of friends overseas, and I have one friend who doesn't go to the doctor because, it's too expensive. Not just one friend, I have many of them who don't go there because of that. I've had, people express frustration when their insurance has been denied. I've read a lot of comments from just strangers. And now, unfortunately, it does seem like that we are going towards the same route, down the same path, because privatization looks to be getting increased, and prices are going up. The waiting lists are, they're pretty long. So unless you get healthcare through your workplace, then and even that is limited. Like, for example, I have pretty extensive healthcare through my workplace, but I don't get dental, I don't get, gynecolog, female doctor visits through there. And, my eyesight, there might be some benefits for that through my workplace if I was a internal employee, not an external one. But anyway, so in this video, I'll be going through these pointers in more detail, as well as sharing some history of the Finnish healthcare system and discussing some of the political pressures and potential impacts on people's overall well-being. So, early beginnings of Finnish healthcare system began around 1640, when the first university in Finland, the Royal Academy of Turku, was established, and this marked the beginning of modern medicine in Finland. 1759, the first hospital was established in Turku, although it was quite modest with only 6 patient beds. And late 19th century, the number of hospitals began to increase, but it was still uncommon for people to be treated in hospitals. 1929, a special committee recommended the establishment of local hospitals by municipalities, laying the foundation for the modern public healthcare system. So this was about 10 years, roughly 10 years after we became independent. Post-World War II era, post-war period, the need for medical care due to war injuries accelerated the development of the hospital network. 1960s to 1970s, Finland developed a comprehensive welfare state, including universal healthcare funded by taxes. And the 2000s efforts to reform the healthcare system began, focusing on integrating health and social services to address access and equity issues. Now, that system also wasn't perfect, but it was definitely better compared to what I, for example, kept hearing from my US friends, for example. Now, since January 2023, Finland's health system has been reorganized into 21 well-being service counties, the city of Helsinki and the HUS group, which was the former hospital district of Helsinki and Uusimaa region. Now, these entities, these well-being service counties, are now responsible for providing health services, while municipalities retain responsibility for public health functions. So there was a structural reform, which a lot of people have found unnecessary and not working very well, you know. I think ever since then, like even before that, but especially ever since this reform, getting to public healthcare has been more difficult for a lot of people. But yeah, this reform has shifted the balance of power, strengthening national level financial steering and oversight. Now, as I mentioned, there's been some challenges. The implementation faced financial challenges. There's been large deficits, and new pay settlements for healthcare workers has been troublesome, and historic under-reporting of budget costs by municipalities. So yeah, that's not really good. And for example, where I live here in Jyväskylä, the municipality in the city of Jyväskylä, we just finished building a new hospital, and that thing was really expensive. And then people, they didn't really get into the care that they needed at the time when they needed it. So yeah, not very good. Now, mentioning a little bit about the health expenditure. In 2021, health expenditure was 10.3% of our GDP, with public expenditure accounting for 80% and out-of-pocket payments for 17%. Now, despite comprehensive coverage, there are gaps due to high user charges and long waiting lists, like I mentioned. So prices have been going up. I remember when I started getting dental treatments to, have my entire mouth fixed, basically. I think I started off, like, anytime I had to visit the dentist, I think it was like definitely less than 20 euros. But then I was in treatment for 3 or 4 years. And during that time, the prices went closer to 30 euros per visit. But yeah, and then waiting lists are incredibly long. Like, if you try to get a dentist appointment, you might have to wait for a year, if you want to go through the public channels. In 2022, 6.5% of Finns reported unfulfilled health service needs, which is significantly higher than the EU average. So yeah, not a great situation. Now, Finns generally report good health, but there are socioeconomic disparities. Like I mentioned, you might not be able to get the dental treatment that you need. Then there's lots of mental health issues, particularly depression and anxiety are common, and it is very difficult to get those treated. Now, if you are lucky like I was, and you can get mental health is covered in your workplace health coverage, then, you're in luck. But if your workplace doesn't cover those things, then you're screwed. Because there's no way you can get I mean, there might be a way, but it might take a long while to get properly treated through the public service channels. And then, you might have to go through private, but that is freaking expensive. Like, I was looking at a session with a psychologist through a private sector, and 1 hour was like 100-200 euros just for 1 hour, so yeah, not very accessible. Now, the changes that the government made regarding these healthcare reforms, they aimed to improve the efficiency and equity of the health system. But yeah, there's now challenges that remain, especially regarding financial sustainability of these new well-being whatever counties, and then the access to the services. And I've seen a lot of comments that people are having to choose whether they eat or pay for their medication and healthcare, and whether they get new clothes for their kids, for school, if they get school books. Sometimes you do have to pay for them. But yeah, and then like I mentioned, waiting lists are astronomical in many areas, for example for dental care, and then going to the private sector is too expensive. And the same goes for gynecologist, the female doctor. For example, I haven't seen in either one in years, not after I lost my status as a university student. And I hope they still get good service. I don't know, I didn't look into that. But yeah, I haven't been to the dentist since 2017. But yeah, anyways, let's move on. Now, some recent changes that have created backlash and the government has had to backpedal a little bit. The Finnish government initially planned to increase the reimbursements for private healthcare appointments from 30 euros to 50 euros. However, after public criticism, they revised the plan. The new proposal targets reimbursements more effectively towards preventative healthcare, such as appointments with gynecologists and ophthalmologists. I have no idea. Maybe is that the optician? I don't know. I have no freaking clue. But anyways, yeah, that sounds good, but we'll see if that actually happens. But yeah, and then there's of course the role of Kela, which is our social insurance institution of Finland. And Kela is involved in these reimbursements and dispersing these reimbursements, yeah, that way. And the government has introduced a pilot program allowing people aged 65 and older to access private healthcare services at the same out-of-pocket cost as public services. Again, sounds very good, I guess, but overall people were not happy about these changes. And yeah, the changes include specific benefits for private healthcare providers. For example, Kela reimbursements for fertility treatments will cover up to 40% of appointment costs starting early next year. Additionally, there are plans to impose a maximum price limit on private services to ensure that reimbursements benefit clients without leading to price increases. However, there's already been posts where people share that, even just talking to a receptionist or whatever, the price has gone up for that, calling them and stuff. And they were also like, it doesn't show in our paycheck, but it shows in the CEO level, paychecks or management in general. And overall, this whole thing has led to some concerns about privatization of our healthcare system and how the role of the private sector is increasing in Finland. And I would argue, and I hope some people at least agree, that prioritizing private healthcare could lead to a system similar to the US. And we know, anyone who's been keeping their eyes and ears open know that the system in the US is broken. So why would we want that system here? So yeah, that system there, profit is the motive, overshadowing patient care. And the involvement of private healthcare giants here in Finland and the adjustments in the Kela reimbursements can be seen as steps towards this direction of the US system. Now, Finland's insurance system is not as problematic as the US, but the trend towards privatization and the benefits given to private healthcare providers, it is worrying. And the government's focus on reducing waiting times in public healthcare by encouraging the use of private services could lead to a two-tier system where those who can afford private care receive faster and potentially better treatment. And that is not good, why? Yeah, I don't know. It's just not good, Any sane person should be able to see that, And then now we have, it's snowing again, great. Anyways, there's a working group from the Ministry of Social Affairs and Health that have proposed reducing the number of central hospitals from 15 to between 5 and 8. This proposal aims to address staff shortages and budget cuts, but this has sparked significant controversy. The reduction would mean fewer hospitals offering 20-hour emergency care and specialized services. And this proposal has faced opposition from various regions, emphasizing the essential role of these hospitals in their communities. Already there are places where you have to drive hundreds of kilometers to reach a hospital. They might even have to utilize the Medi-helicopter. I forget it has a cool name. And now they're thinking about reducing from 15, when people are already struggling to get the healthcare that they need, from 5 to 8. And for example, there's been talks about politicians who want to vote against this change. However, for example, if I understood the news correctly, Riikka Purra, the leader of the Finns party, has been pressuring members of her party to adhere to the party line when voting on critical issues, including healthcare reforms. And this has created tension within the party, with some members publicly expressing their reluctance to support certain proposals. And the enforcement of party discipline is seen as crucial for maintaining the ruling coalition's stability. But it's also I get it in a way that you have to stand in line when it comes to certain political decisions. But if your own party members want to vote against this decision, then why don't you listen to them? Anyways, let's go through real quickly some comparisons with the US system. So, in my opinion, at least, these recent changes in Finland's healthcare system, such as the increased reimbursements for private healthcare and the involvement of private healthcare giants, they do bear some resemblance to the US healthcare model. And in the US, the healthcare system is largely privatized, with significant involvement from private insurance companies and healthcare providers. And this profit-driven model has led to some of the highest healthcare costs in the world, with many Americans facing substantial out-of-pocket expenses and limited access to necessary care. And at worst, this system has led to many people dying because they didn't receive the care they needed. Families have had to watch their family members suffer. Some may have taken matters to their own hands, so as not to be a burden to their own family. Now, in contrast, Finland has traditionally relied on publicly funded healthcare system known for its quality and accessibility. Of course, there's been problems before as well, but in general, it's been better than the US system. Like, for example, I stayed in the hospital for, was it 2 days, 3 nights, and I paid like 100 euros for that, 150 maybe at max. And I didn't have to pay for the jaw surgery at all because I was a student. So that was funded by the government, taxpayer money. And yeah, everything that I had to pay myself was just the visits to the dentist's office and then the hospital stay, So it wasn't a whole lot of money. And, I've heard stories of American tourists having to, use the ambulance services in Europe, and they've been like, oh no, I don't want to, it's going to be so expensive. And then people have been like, no, it's not, you don't have to pay for that. So, the recent shift towards privatization definitely, in my opinion, raises concerns about moving in a similar direction as the US. And the risks include increased healthcare costs, reduced access to services for lower income individuals and families, and potential decline in the overall quality of care, and potential decline in people's overall well-being, not just their mental well-being, but their physical and dental, So I think Finland can learn valuable lessons from the US experience. The US healthcare system's focus on profit has often led to inefficiencies and inequities, with many people unable to afford the care they need. By prioritizing patient care over profits, Finland can avoid these pitfalls, ensuring that healthcare remains accessible and affordable for all citizens should be a top priority. Moreover, Finland should focus on strengthening its public healthcare system, addressing issues like long waiting times and high user charges, rather than shifting towards a model that prioritizes private profits. By doing so, Finland can maintain its reputation for providing high-quality, equitable healthcare and avoid the challenges faced by the US. And by steering away from uber privatization of our healthcare system, we could avoid incidents like the assassinated United Healthcare CEO. So, to summarize this video, we've explored the recent changes in Finland's healthcare system, including the shift towards privatization, the reduction in the number of hospitals, which hasn't gone through yet, but we'll see what happens with that. I hope it doesn't go through. And the political pressures influencing these decisions. They've also discussed the potential impacts and compared these changes to the US healthcare model, highlighting the risks of moving towards a profit-driven model. And it's clear that these developments could significantly affect the accessibility and quality of healthcare in Finland. Now more than ever, it's crucial to stay informed about these changes and their potential impacts. Even if you're healthy now, you never know what's going to happen to you. You just never know, when you might need these services and you would want quality treatment that doesn't cripple you financially, And again, I highly urge everyone, especially decision makers, to consider the recent CEO assassination case and how following that, a mother of 3 was recently jailed with an astronomical bail amount simply for expressing her frustration for her insurance company. I encourage you to participate in public discussions and voice your concerns and advocate for a fair and accessible healthcare system. And I think that by working together, we can ensure that healthcare in Finland remains focused on patient care rather than profits. And I think one thing more to note about the CEO incident is that people were recently very divided because of the presidential elections in the States. But now everyone have come together because they have this, how to phrase it, but let's just say that people have remembered the qualities. I don't know if I can say that on a video, but people have remembered that, hey, these rich folk, they're actually fewer in number than us, and now they're getting scared because of this one guy getting killed, and that has brought people together, so yeah. Anyways, yeah, here in Finland, let's just not wait until it's too late to protect our healthcare system. And it's important to think, what kind of healthcare future do we want for ourselves and, the generations that come after us. But yeah, this video is long, I guess, but hopefully it was informative. And again, I urge people to stay informed, even when the events are happening overseas. Because, like I said, the situation in Finland is related to the situation in the US, because we are slowly headed towards their direction when it comes to healthcare. It has not worked for them, and now there's this event that sparked people to react very strongly. So politicians in Finland should be taking notes from that. The people's reactions, not the other CEO's reactions overseas. Anyways, I hope that the lady who got jailed for standing, for expressing frustration towards the insurance company, I hope that she is freed, and that the suspect in the CEO assassination, I hope that he receives a fair trial, and that this incident will be bringing some changes in the US healthcare system as well. Anyways, that's all I have for this week, for today. And next week, well, I might have 2 videos this week, because next week I'll be traveling, so I won't be able to record when I'm out at my parents', for Christmas. Is it already Christmas next week? Yes, it is. But anyways, yeah, take care everyone, and stay healthy, safe and warm. Cheers.